habit change is one of the hardest things that you can do. And I would never expect for someone to be like, oh my gosh, I think I'm menopausal. And then be like, okay, here's the laundry list of things that you need to fix by tomorrow. Said no one ever.
There is a buffet of HRT choices. Can you give us the 101 on the differences between, pharmaceutical, bioidentical, compound hormones? What's your view on blood tests? What are your must-dos for the menopause pre-season?
This decade is going to be amazing because I've done the work. And even if I haven't done the work, it's never too late.
Quick favor before we start. If you're enjoying these conversations, please hit follow and rate the show. It helps more women find us, and it means I can keep bringing you brilliant guests and empowering conversations. Dr. Jessica Shepard, welcome to MenoPositive.
I am so glad to be here. But of course, the best part of all of this is that we're both Canadian.
Yes, of course. We
Yes.
have that connection.
Yes.
We also have left Canada, but
True.
That's
But our
okay.
roots are still Canadian.
Our roots are still Canadian. Jessica, I knew you were my kind of doctor when I read your book and you set out the 3 stages of menopause as the pre-season, the main event, and the after party.
Yeah.
And what I love about these titles is, one, they give you a real sense that you have some control over it, but
Mhm.
2, they also bring a little joy to the conversation.
I really wanted the book to reflect that part of our lives because many times we're told the parts of our lives that are going to be so horrible and not great. And I find that a lot of how we take in and how we set that expectation for our life can truly be the experience. And so, especially for every woman who's going through these transitions, who one probably doesn't know what the hell is going on, but two are kind of, whether they're told from family, friends, physicians that it's going to be horrible, then we're kind of like setting this stage for a not fun journey. And I think that this journey can be something that we can embrace. Are there going to be tough times? Absolutely. Whoever said that life is easy, first of all? And then we get to decide, just like you said in the beginning, on how we want to do that journey. And I think that that's where I wanted people to close the book and say, I feel empowered. And even on the days when it may be my worst or I'm having a symptom that is horrible, I know the full experience can be something that I can look back and say, I'm proud of what I did.
And who doesn't like an after party?
Right? I'm always about the after
We're
party.
always about the after party. And I think that's really interesting what you said, because there are still so many people who believe that menopause is something that happens to them, and
Hmm.
it's not something that you can manage through. And I
Correct.
think that's really important. So, kick us off with can you give us an overview of the 3 stages? Like, what do you mean when you
Yeah.
say preseason, the main event, and the after party?
Yeah, and I even made it simple with putting the same letters. So for perimenopause, the pre-game, the pre-season truly is that time frame where things start to happen with our hormones here or there. And so you have these subtle symptoms that may stay and then they go away and you're like, did I really have a hot flush? I'm not sure. And it's kind of like that questionable period. Did that really happen? And so a lot of women that I see in my office, and that's what my practice mainly focuses on is perimenopause, menopause, longevity, is they would say, I feel like this is happening. So almost like a question, but I'm not quite sure. And so then when we kind of sift away through the questions and get more of the experience behind it, more so than just looking at labs, is you are experiencing this kind of shift in hormones. And it is the lead up to the main event, which is menopause. So the M for menopause. And so I want women to truly have an understanding of what that really means. So, one, they don't feel crazy, that they're like, okay, yes, it did happen, and here's why. So, giving them context and understanding, that's the education part of it. But also giving them the reassurance that what they felt was real. And that then ties a lot into as they now transition into the menopausal event, which technically if you think about it, is just 1 day because menopause clinic it's a very clinical term. It is something that we share among clinicians to emphasize this woman has not had a period in 12 months consecutively. So it's kind of like a code word. And so when they reach that 12 months, we can clinically say they are menopausal. So menopause really just hallmarks you've now done 12 months without a period. So it's kind of like that 1 day where I call it like a birthday that no one's really waiting for.
No, I
And then
love
when you
it.
go through it,
I
yeah,
was like, thank you for explaining that because when it was me, the word that we do use menopause as a general term, don't we?
yeah,
And when I was going through it, I was like, is this one is it 1 day? Is this literally
yeah,
marking a moment? And if it is, eventually I want to get to the place where we do celebrate that moment. Like I'm talking cake
correct.
and balloons. We
Yeah.
really should be celebrating it because I know you also talk about it as kind of the entry into the next part of your life.
Mhm. Yeah, that transition into again this and I say this all the time if it were a movie script. We have now typecast menopause to it's horrible, right? And so then it's like this horror story we're expecting and I say change that. Let's change the script on that. Let's change what our mentality is behind it, how we think of it. So when we do enter that phase, one, we were prepared because we never told perimenopausal women what to expect and that it was going on and this is what was happening. Then they would just hit this brick wall. And we're like, oh yeah, by the way, you're menopausal. So now we have like educated the preseason, pre-game, perimenopausal phase. We get to menopause and we get to decide what we want that chapter to look like. You said it on entry. 40% of our lives are lived in the menopausal phase. So menopause, once you pass that threshold, you are menopausal or postmenopausal till the day you die. Like it's not like it reverses or goes back to perimenopausal. So why do we feel that we have to experience this chapter as horrible? And I feel so many women that I've seen in their 50s, 60s, and 70s, it's like they carry this cloak of like heaviness because they're menopausal and what comes with it. Change in mental status, our cognition, our libido, our bones, our aches, and all of that that come with it. But we actually can do it in a way that is powerful to ourselves and offsetting a lot of what happens and this kind of downhill effect that we have seen women go through quite rapidly over the years. Now I feel that I am hopeful and optimistic in the field of medicine that we are giving women more tools and education to offset these symptoms and how we respond to menopause because it is a whole
Absolutely.
body experience.
Yeah, and I mean, this is what this is about is offering people a whole pick and mix of everything from the most witchy to deep
Yeah,
science, because every woman is gonna experience it differently, and they can pick and choose, what tools they wanna use, but like you said, they get to choose how they're going to spend the second half of their life.
we all get to choose. Yeah.
So let's start with, perimenopause. What are the body's first whispers around perimenopause?
I would say the first whispers a lot again has to do with the period because that's kind of how we hallmark how your ovaries are giving off estrogen. Is it continuous? Is it declining? And so you'll start to see the period change. So a lot of women in the perimenopausal phase will go through skip periods, irregular periods. Sometimes they'll increase in heaviness. Sometimes they'll decrease and have very light periods when maybe they had like a different frequency and heaviness to it before. So it is kind of this change of however that shows up, and that can be very different. I would say that's probably the most common whisper. I like that term. And then secondly, I would say a change in two other things I would say, change in kind of mental, whether that is we start to see an increase in anxiety and depression. So kind of like that mental status change. And also brain fog and not remembering or not being able to multitask as well. And then thirdly, I would say is hot flashes and night sweats, like these subtle and I notice it actually in a lot of my friend groups and patients that I see in that 40th decade is they start to see when they drink alcohol maybe that they start to have more hot flash responses, whether that's at night or even throughout the day. And that means that they are still having these changes in the temperature control of their body and sometimes the decreased ability of your brain to kind of keep it at that thermometer level that we are so used to. And that has to do directly with estrogen and it declining. So there's all these things that start to happen. And that those I would say the three top subtle things.
And it's really interesting because I think things like the Aura rings or the
Yeah.
Whoop bands or whatever it may be, are all also showing it to us afterwards. Like you
Right.
said, if you've, spent the night out drinking and you've had then in the morning you can see it, or even,
Yeah.
like you can see your daytime stress and how it's I have a friend right now who just got one and she tracks her daytime stress and it's freaking her out. I'm like,
It's
"Stop
stressing
looking
her
at it."
seeing her stress. Yeah.
Yeah, exactly, exactly. Now, I think, I've also met a number of women who are on the Merino
Yeah.
coil, and obviously they're still having their period. So, the symptoms, I guess the period symptoms, the length of it or the size of it, heavy or not heavy, is not a symptom for them. So, what is something that they can look for? Are these other symptoms like hot flashes and night sweats or
Yeah.
fatigue, are those the things they should be looking at?
Yeah, they'll start to see that, and they still might actually experience some changes even though they have the intrauterine device with progesterone in, because now they are having different levels of progesterone versus different levels of estrogen. So there still might be some changes that they might see, probably a little bit, more subtle than someone who does not have that form of birth control. Yeah.
Right, right. Now, what's your view on blood tests? Because a lot of
Yeah.
women, they'll go get their bloods done and it comes back as normal. And I've got the
Mhm.
air quotes for those who are just listening. But could we talk about the disconnect between
Yeah.
labs and lived experience?
Yeah, I love that you put that beautifully, lived experience, and this is where I really wanna kinda, like, tug at the heartstrings of my fellow clinicians, is labs are a great tool, and we use them really well, and we are able to identify things that usually are wrong, when labs are not "normal," quote, unquote, "normal." It is hard, I would say, now coming back on the other side for women who are listening, when they go to their clinician and say, I still have my period, but I want you to do labs to see if I'm perimenopausal. One, we already know you're not menopausal because you still have your period, right? So we can easily put you in the perimenopausal category. With that being said, because you still have estrogen fluctuating because you have your period, right? There's enough estrogen to elicit a release of an egg to give you a bleed. That's how we know. Is that your estrogen will still signify some level at which it's high, low, mid, wherever you are in your cycle, because it's still being emitted from your ovary. So the labs are not always going to help us in any way. Do you have enough estrogen or not? Because you still have enough to give you a period, whether it's irregular or regular. With that being said, the other side of that is this is where the joint conversation can come between a patient and a clinician now that we've kind of cleared those two things is I can run your labs. This is what I tell my patients. Will it tell me everything I need to know about your estrogen? Not really, because I know you have your period. But what I'm more interested in is hearing your lived experience of what's going on with you in regards to this perimenopausal phase through hot flashes, night sweats, change in libido, dry vagina, that's what I want to know because that's where I know I can help you with hormone replacement therapy or any other modalities, whether it's devices, whether it's with other medications that help with the lived experience that you're now having through perimenopause. But do you want to see your labs? Great. But I always back it up with it may not tell you or me a whole lot, but I will run them, and then we can talk about your lived experience. And the other thing that I would say is testosterone is typically something that does not have to do with your cycle, but it is very helpful for me to know. So I usually do run a testosterone. I run your hemoglobin A1C to see if you have any insulin resistance. I also run your vitamin B12, your vitamin D, and your thyroid panel. That's what I run when people come in, just not your estrogen, because as this whole body experience that women are going through, I do not want you to get to a point where now you have a disease because I refused to kind of look at some precursor, some biomarkers that could have helped you and me manage your transition better.
I think that's a really interesting point because I think the discussion around hormones always tends to talk about the sex hormones, but there
Yes.
are so many more hormones that,
So many other.
again, if they're low, if they're like you said, they're kind of biomarkers that show
Mhm.
that there is something else going
Yes.
on in you. Now, you talk about in your book, and you've related menopause to running a marathon, right?
Yeah.
And you wouldn't run a marathon without training.
Right.
So why are we stepping into perimenopause without a warm up?
I have no idea, and our muscles are like, help me for this marathon."
You have in your book, so what are your must-dos for the menopause preseason?
Yeah, the menopause preseason, I would say, are a lot of lifestyle factors. And the reason why I focus on that so much is how we live our life after the menopausal transition, or even going through the perimenopausal transition, is that our lifestyle a lot of time dictates what that lived experience is going to be, because we fundamentally have a responsibility to give our bodies the best chance at going through this aging process, because there's an aging process that's going on as well. It's not just all chalked up to reproductive hormones. And so, with that being said, I focus so much on how are we going to shift our diet, our nutritional foundation, our framework? How are we going to incorporate and change the idea of exercise and what modalities now should be more important than it was before? In order to prepare. But the other thing, and I know this in my practice because it has so much to do with holistic changes in medicine and alternatives, is that habit change is one of the hardest things that you can do. And I would never expect for someone to be like, oh my gosh, I think I'm menopausal. And then being like, okay, here's the laundry list of things that you need to fix by tomorrow. Said no one ever.
Yeah,
So
in
why
that one
not
day,
give
on
you
that one day,
in that
right?
one
Like,
day?
yeah, it's like all of a sudden you turn whatever, late 40s, whatever you hit that day, and they're like, "Okay, now you need to change everything about your life."
Everything about your life.
Yeah.
And so
You've been doing it all wrong this entire time.
exactly. Like, why would we expect those types of changes that we know are gonna be our best kind of friend in this whole aging? Because this is lifelong work. I want you to be able to have sustainable changes that when you're 70, you're like, I'm so glad over the course of years I've been able to focus on the changes that are going to help me best. And I've now gotten to this phase. And we all know that diets, and when we think of trending like diet fads, is they always market it. The best way is to being like, you only need to do this short time frame to get this outcome. That's not how the body works. And so I love to give women this 3 to 7 year time frame of subtle changes that's the way you live your life, and then you get the outcome that your body is like, thank you so much for doing this for me.
I love that. It's your game plan.
Yeah.
So, knowing that we need a game plan, I know there were 5 things in your book. There was start tracking your cycle, establish a sleep routine, mind your muscles. I know you were big on muscles. You and I connected on that. Begin a meditation practice and don't keep it to yourself. Like, talk to friends, share it with them. I want to touch just briefly on the meditation practice because
Please.
I want to direct everybody listening as well, because what I love about your book is some of these things may be really far away from where a person is at a certain moment of time. And you have, I think they're called building blocks, like throughout your book.
Yes. Yes.
To me, they were like, this is your entryway into meditation. This is your entryway into better sleep. So you do include these tips on how to start if that's the area that you're interested in.
Yeah. I felt that when I parceled kind of the book out, was I have a lot of information to share. And yeah, I'm a physician and I'm a menopause expert in this. So I do in my practice. And there's so much that comes with it, so much knowledge and education. But again, like I said, when it's time to actually do the work, when it's time to actually take in the information and now I'm actually going to apply it to my life, a lot of times those steps are missing. And it's so important for me to have people understand in themselves, I'm taking these steps and here are the best ways to now get this outcome that I'm looking for. And I felt if I didn't put those in, then it was, again, just a really good book. Shameless plug. It's a really good book, but there weren't any transition points and tips and how to actually accomplish or how to actually get there.
I also wanna say to the people listening, like, sometimes you just need to pick one thing. You don't
Mhm.
need to overwhelm yourself. Like, if it's about establishing a sleep routine, start there. If it's
Mhm.
about going out for a walk every day, start there. Just choose one thing, and that's your building block, and then you can lay more bricks, more bricks, more bricks on top of that.
That's actually how I manage my patients in my practice. When they come in, a lot of times there's so many pillars of what needs to be addressed: nutritional, exercise, hormones, supplementation, devices for vaginal dryness. And so I will expose all of it in our consult. I'll be like, This is what you came with. This is now the things that we can do to help." I go, "But where we're starting today is just one of these." Because again, this is a marathon, not a sprint. And I really prefer the layer cake approach where I'm like, let's bake this cake and then we'll come back and we'll get some icing. Then we'll go back and bake the other cake and put it on top. And I'm like, that's the way it should be approached. Because if you think I'm going to hand you this and all these things, these key items that you have to hit, and then follow up with you in 3 months and making sure you've done all of them, we're both setting ourselves up for failure.
Let's move on to menopause and the after party.
Yeah.
Now, I thought it was really interesting in your book as well, because you said if there were women that had maybe sailed through perimenopause, they tend to catch up with their sisters in
Hmm.
menopause and
Hmm.
start, this is where some of the symptoms maybe are at their height
Yep.
before, or, they're slowly starting to wane. So what can women expect then? So they've had their one day, they've 12 months, they've had the cake, celebrated that they've hit menopause. They are now in the after party. What kind of things are we looking at in the after party?
Yeah, when we look at the menopausal transition and when women go through it, that first 2 to 3 years, what we've seen in studies is usually when women will go through their highest kind of experience of symptoms. So when we're talking about perimenopausal women who kind of breeze through it, a lot of times at that kind of decline in estrogen, when it hits that zero level, I guess you can say, where they're not having a period anymore. That's really a lot of times where those symptoms will really come full force in those first 2 to 3 years. And so, however women experience that, because there's always differing intensities, severities, and frequencies of all of these symptoms. A lot of times it is very telling within those first few years that women are like, "Oh, it's here, folks. It's here to stay." And so I say that when we're talking about exactly how you stated it, is that your perimenopausal experience may not always shadow what your menopausal experience may be. So people may be like, "Oh, such a breeze, that perimenopausal phase." And then they get into menopause and they're like, "Oh, this is for real." So I always like to let people know that sometimes how you experience perimenopause may not directly, reflect how menopause will be experienced.
I wanna take a beat and talk about mindset. I mean, the
Oh,
show
please.
is called MenoPositive.
Yes, please.
You say in your book that having negative beliefs about menopause actually leads to your experiencing more menopause symptoms,
Mhm.
especially at work. That's wild. Can you
Yeah.
unpack that for us?
Absolutely. This is probably one of my most favorite topics when we think of the perimenopause menopausal experience because we again limit it to, oh, it's just a reproductive hormone issue. And I would say that there are estrogen receptors all over the body. They're not just located in the pelvis. They're in the brain, the muscle, the heart, all these different organs. The one thing that I would say for my patients that I really try to kind of steer them in the direction of is how are we mindfully going to go through this transition? Not only just from a menopausal position, But for our lives, I think as women, we tend to not focus on our minds and settling our mind, learning how to quiet our mind in the storm. And I scientifically, through research, know that there is a decrease in estrogen, cortisol increases, stress increases. A lot of women going through this phase are in the sandwich generation where they're taking care of older parents and younger kids. Relationships struggle during this time. This is the highest time frame in where you'll start to see divorce. And on top of that, you're now going through this hormonal shift that is actually impacting how your neurotransmitters respond as well. So, all those things I just listed, a lot of that is tied to how are we going to kind of bridle the wild horse that is trying to go out of control, and that is your mind has the ability to control that. We don't pay attention to our mind because we're not taught how to, and when you really lean into it and take an inward look at this whole journey and how you're feeling through it, if you can tune into the power of your mind and what it's capable of doing, I do believe that that can get you through a lot of the stressful moments, the hot flash moment. That's why I do definitely, and in the book, you'll see that look at mindfulness, meditation, and yoga practices, because that has been shown to decrease some of the symptoms that women go through in menopause. Because what? They're using their mind to control the symptom or the awkward phase of what you're going through. That has completely transformed my life, I can say personally. And when I do share that with patients and refer them to a therapist, a life coach, or a meditation teacher, they start to notice how their life shifts in what's what they're responsible for as far as thoughts, how they can control stressful situations, and really capturing the beauty of the mind when it's going through something that is rather rough.
So I think, you touched on yoga, meditation, and I know you always say not always, you also have said how cognitive behavioral therapy can
Yeah.
really support
Mhm.
women during this time as well.
Yeah.
And yeah, I thought it was I think it was reduces hot flashes by 50%. There's been some studies like CBT
Yeah.
has reduced hot flashes by 50%, night sweats by 39%. So I thought that was pretty cool. And I
And
think
the reason why I bring up the kind of mindful approach and the cognitive behavioral therapy, it is listed, and I know there's a lot of controversy behind that because even though it's listed, I do think that some clinicians feel that it is not necessarily the best way to do it. I always say that hormones, I'm always a hormone advocate as far as hormone replacement therapy, but I love being able to add on something that is truly that you have control of, which is your mind, and learning how to use those modalities so that you can actually use both. And then for those people who don't want to use hormones, what a beautiful way for them to, again, help with their symptoms that is not hormone based. Yeah.
so you brought up hormones. So let's move
Mhm.
on to HRT because
I
I
mean, I guess we're there.
we are kind of there. But I wanted to because also Generation M is a generation whose mothers lived through the WHI study when it made the
Yeah.
front page of
Yeah.
everything, and that's the Women's Health Initiative study, which, like I said, made the front page. So we're kind of children of that generation, but it was 2 decades ago. Can you please help give us an update on since then, what kind of research has been done, what we need
Mhm.
to know today so we are not hanging on to this old information?
Yes, it is. I would categorize as that as old information. That is the beauty of science and research is that we're always evolving. And just to give a nod to the WHI, it was not that it was a bad study inherently. What made it, again, kind of the source of why we are 20 years without really good hormone supplementation being offered is that what came from the study was some information that was reported incorrectly and the incorrect kind of messaging, to me, it was just bad PR, was not the only thing out of that study that was, we should have kind of had caution with. Let me say it that way. There's so much good out of that study that even in retrospective analysis of the study was like, oh my gosh, there actually is a decrease in colon cancer, or this is how it impacts heart disease. So fast forward 20 years. right, is us looking at that study retrospectively, but also doing new studies and saying, how can estrogen benefit us? Why is estrogen and progesterone as a combination necessary? Why are these things actually helpful for our brain health, our heart health, our bone health? And now we are starting to enter into that phase of looking at the positive, the menopositivity of hormone replacement therapy and helping women truly make better decisions for themselves because they can see the benefits. There is always going to be risk with anything that you take or consider. Every individual, however, gets to decide of that risk. In my experience, that's why I love the word lived experience. What am I willing to take as a risk to offset how I would like to choose this chapter in my life? Everyone gets to choose and make a decision based on good information that gives you also the risk, but also the benefit, because it's going to be different for everyone.
And I think the main discussion, obviously, around that study was the link to breast cancer. And
Yes.
you have spoken before that it's, I mean, in your words, how do you speak to women who still have that fear of the link to breast cancer?
Yeah, the whole breast cancer issue of the WHI was that it was a very end statement of estrogen causes breast cancer. That's literally what patients still today say, and what was the messaging when I say the bad PR part of the WHI. What we do know is that estrogen actually is quite protective of breast tissue. And in that study, when they looked at their retrospective analysis, it was not the estrogen that gave that slight increase or relative risk or absolute risk to breast cancer. It was the progestin, which was a synthetic progestin used in the study, that increased that risk of breast cancer. So, one, estrogen was not causing breast cancer. There are people that are prone, whether it's genetic or they have a gene that is going to predispose them to breast cancer, that can be precipitated, but it's not the cause of. Do you see the difference in those statements?
Yes, and I
And so,
also understand
yeah.
you have said, like, there was the myth that obviously that breast cancer, handed down generation to generation. Like, it's about having the right conversation with your doctor
Hmm.
about your personal history
Correct.
and again, having the conversation where you'll find out if it's the right choice for you.
And the other thing is, what's big in that study and studies that have been done since then, when we think about breast cancer, because let's extract just that one outcome of when we think of hormones, is what actually is more leading to breast cancer than necessarily being exposed to hormones is drinking alcohol and obesity. So those are things that we actually have absolute control over that's going to decrease our risk of breast cancer. So again, it's taking everything in context and saying, where do I lie in this risk, benefit, lifestyle, family history, and what choice at the end of all of that, with the best information possible, do I want to take?
And to make it even more confusing,
Let's do it.
yeah, there are so many different ways you can take HRT. There
Yes.
are gels and patches and
Yeah.
lozenges and creams. There is a buffet of HRT choices. Can you give us the 101 on the differences between, pharmaceutical,
Yeah.
bioidentical, compound hormones?
Yeah. So I'll start with pharmaceutical and compounded, because those are the different ways in which they're made. And both of those modalities can have bioidentical forms. And the reason I started there is most people say that if it's pharmaceutically made, it can't be bioidentical. So I'm going to start back again to make it clear because it can be confusing. Compounded and pharmaceutical are the ways that hormones are made. Both of them can offer bioidentical options through either of those modalities. Now, when we look at pharmaceutical, they will obviously have more synthetic offerings because they're pharmaceutically made, but they also do have bioidentical forms, such as the patch. The patch is made by a pharmaceutical company, but it's bioidentical. Now, compounded versions of hormones are always going to be bioidentical because that's how they're made. So again, it's not one against the other. It's the variety within each that someone gets to choose how they would like to receive their hormones. So compounded typically will have more bioidentical versions or options but it doesn't mean that a pharmaceutical doesn't make bioidentical hormones.
And how does a woman decide what's best for her? Is that again a conversation with her
Oh, yeah.
doctor?
This is su and like you said, there's such a buffet. So when people come to see me, I'll give, like, a short snippet of what a consult would look like right here on MenoPositive, is that you come in and you express what you're going through. I always like to start, "Let me meet you where you are." So after we get through that conversation of what your journey is like at that moment, I say, "Here is what hormones are good for, whether it's estrogen, progesterone, and or testosterone. Here are the ways that they can be taken. Like you said, a pill, a patch, a lozenge, an injection, a pellet, a gel, a cream." And we go through all of those options and then we list the modality, the frequency of how they're taken, how they can be pharmaceutical versus compounded. And from that buffet, then someone gets to say, "I'm interested in these two or three choices here based on my symptoms. This is what I think would be best for me." And I'm like, "Yeah, estrogen is good for this, progesterone is good for that because you have that symptom." And they'll say, "Based on what I think for me and my choice and what you've offered, this is where I think I would want to start. What do you think?" And then I'll give them feedback. And then a lot of what goes into choice too is people's lifestyle. So for someone who's like a high traveling patient maybe is like, "I do not have time to do a daily." And I'm like, "Let's look at maybe a patch, which is twice a week. Or let's look at maybe an injection, which is weekly, or a pellet, which is every 3 months." And so then they get to decide for themselves, this is my experience and this is how I would like to do my hormone replacement therapy. And the good thing is, guess what? Now that you have all this information, I always tell everyone, it's not like when you make a choice, you cannot change your mind. I'm like, if you come back in 3 months, you're like, "You know what? I tried the patch and maybe I want a higher dose of the patch, or I want to completely change to a pill and or an injection." Great. Let's do that
You
because
bring
you
up a
get to
great
decide.
point. Yeah, you bring up a great point though, because I've talked to some friends, a couple things. One is when they've passed their 12 months, like the menopause, and they've done that moment, they're at the after party. One thing is, "Oh, I'm past that stage. I don't really need to think about that." Or the other thing that comes up in conversations is, "Oh, I've tried it and it's not right for me," or "I tried it and I felt awful."
Yeah.
Uh, talk what do you say to patients like that? Because from what I understand, it's like I mean, it is like a cocktail. You kind of like,
Mhm.
"I want a little bit more" or your cake, let's
Yeah.
use your cake analogy, is like, "I need a little bit more sugar," or "I need a little bit less sugar," and it's a conversation. It's not just a one and done exchange with your
Mhm.
doctor. So, is that how you like to work with your patients?
Yeah. Again, the layer cake approach, and I'll bring it back to that is this is where we're starting. Is it going to magically make everything better by tomorrow? No, because that's not how your body works. And now that your body is utilizing these hormones to now shift some of the functionality deficits it was having or some of the limitations it was going through, we're going to see over a course of time, maybe 3 or 4 months, how you adapt to it. From that, I can either increase the dosage of what you're taking because it's not quite working, or if you feel horrible, we'll take you off and put you on something else or lower your dose. And so it becomes this barometer of where are you in the mix? How are you feeling? And going back to again, that tagline of this is not a sprint, it's a marathon. And if we have to spend 6 months to a year to get you to where you feel better and you're like, this is my jam right here. This is the mix that I want. And then we sail, then we're good. And
Alright,
we may need to tweak after that, but what's your jam?
yeah, oh, let's back on the music. That's
Yeah.
back on the music, exactly, right? And, I mean, we talk about HRT, but I also know you are you have a lot of belief in food and exercise as medicine. If anybody looks up Jessica on her Instagram, okay, like, you should see her toned pipes. I mean, I can see them right now, actually. She's got some really toned arms. I remember when I first saw you speak, actually, you had a slide that said muscle equals life, and I took a picture of it. I actually referenced it in another episode we did on strength
Yeah.
training. But I think let's not forget that these lifestyle changes are also a big part of the after party.
Huge.
And I think you talk about all of this from preseason through to after party is actually taking a look forward to the 7th decade, 8th decade. How do you want to live then? Do you want to be able to pick up your grandkids? Do you want to be able to lift your own suitcase in the overhead compartment on a plane? And when you know where your destination is, then you can have your
You
game
can
plan
plan.
for getting there.
Yeah. The destination is everything, and the journey is just those day-to-day moments, those celebrations, those obstacles, those failures, those successes. It's the compilation of all of that. And that's how we should approach our life and approach our life in a way where even though you may see a storm coming ahead, which some people might equate menopause to, is that one, the storm doesn't last forever. But do I want to enter that storm with an umbrella and a raincoat and boots? Or do I want to enter it with nothing and not having prepared in the best way possible that I can?
And on that note, let me ask you our final question. Knowing what we know now about the 3 stages of menopause, what would you tell our 35-year-old listener?
I would tell my 35-year-old listener that this is lifelong work. And with lifelong work comes the choices in which you get to engage in based on how much you want to enter that journey. We all get a choice in how we want to enter this journey of life. And I would hope that when you look at that journey that's ahead, that you would want to enter it in a way that's passionate and that really centers yourself around it and looking inward.
And what would you tell our 45-year-old listener?
I would tell our 45-year-old listener that we've entered this kind of wave moment of our life, and we get to decide how rough those waves are. And through those waves, there are moments that we get to focus on tranquility. And I would hope that we can lengthen those moments of tranquility through the mindfulness
I
approach that we take.
I like that idea of the mindfulness. 55-year-old listener?
55-year-old listener, these are the years that we get to be in charge. And I want people to have ownership as they are 55, looking at this decade is going to be amazing because I've done the work. And even if I haven't done the work, it's never too late.
I like what you said there. Dr. Jessica Shepard, thank you so much for being part of our MenoPositive community and for everything that you're doing to empower women through this next transition. It has been so great to see you and to talk to you again. Thanks for being here.
Well, thank you.
I want to leave you with an extract from Dr. Shepard's book, which sums up today's show perfectly. There is nothing fiercer than when women band together for a common goal. That's what Generation M is all about. Defining ourselves, advocating for ourselves, making ourselves heard. That means saying no to shame and yes to having a sense of humor. It means saying no to keeping silent and yes to talking openly about what we are going through. It also means a hard no to being ignored and a strong yes to demanding answers from doctors and the medical community. It means absolutely no to a world where women's sexuality has an expiration date, and yes to, well, whatever we damn please. Is that a lot to ask for? I don't think so. See you next time.
I got a good feeling.